Welcome back. There are more than 6,000 Florida children in foster care who are eligible for the COVID-19 vaccine.
But the ABC Action News I-team discovered the state has no idea how many of those children have gotten the shot.
In a Full Circle special report, I-team investigator Kylie McGivern discovers why they're not tracking these numbers and the implications they could have for kids and families like yours.
The child welfare system, already strained and struggling for resources, has been pushed to the brink. Foster parents, caseworkers, staff not letting up in the pandemic. They really don't have a choice with thousands of kids in need of a home.
We're all putting our lives at risk just like the frontline workers.
We spoke with a foster parent who asked that we not show her face or use her name for her safety and fear of retaliation, and to protect the kids in her care, several whose parents' rights remain intact. We'll call her Anne. So how long have you been a foster parent?
For about 30 years, and we've raised about 200 boys. We're working the best that we can to raise other people's children, but it is affecting our personal lives where we could actually die because the child goes to school without the shot, bring it back to us, or affect other children in the house.
Which is why Anne says they made the decision to do Pinellas Virtual School, a choice she says has been all-consuming, working to help get them through it.
They're working from like 7 in the morning to 9 at night.
While she and her husband are fully vaccinated and have health concerns, some of the kids aren't old enough yet. Others, the parent won't give permission. Like in one case, Anne says, where the little boy wants the vaccine for his birthday.
He wants a COVID shot, and he will be denied. We brought it to court. Even the court can't change that. There's a law that says even though the parent was abusive, didn't make good choices for themselves or the child, that they still have the right to make that decision.
Several other foster parents we communicated with did not want to go on the record about struggles to getting kids vaccinated, also fearing retaliation. Hillsborough has more children in foster care than any other county in the state.
The things that really we're struggling with immensely is, the health and safety of everyone in the system.
Rebecca Capusta heads up Eckerd Connects, the lead agency contracted to handle foster care for the Tampa Bay area. At least 263 kids have tested positive for COVID-19 and 143 staff under Eckerd Connects.
That's our biggest challenge right now, is being able to find places for these kids to go during the daytime or overnight.
When it comes to vaccinations for the more than 1,000 eligible kids 12 to 17 years old,
I just don't think that a lot of them are taking advantage of it, but I don't have the data to be able to articulate how many are and how many are not.
So Eckerd does not know how many children within its care have been vaccinated?
No.
A DCF memo says caseworkers must document the consent and administration of a child's vaccine in its database. But beyond a note in the system, DCF tells the I-team at the state level it does not track or collect the data. So Eckerd is now working to set up its own system to do just that.
Because it helps us keep them safe. It helps us keep our workers safe.
This needs to be a priority.
Robin Rosenberg with Florida's Children First, a nonprofit advocating for the rights of kids served by state agencies, says while data is needed.
To me, that's not as important as not making the effort to get everyone who's eligible vaccinated.
You see a problem with the fact that there hasn't been more of a priority to get every kid within the state's care 12 and older vaccinated.
Yes.
The latest memo DCF put out is nearly 5 months old now. Bottom line, it says a child must meet the FDA's age requirement and request or consent to a vaccine.
At the end of the day, we do not have the ability to make a child or force a child to be vaccinated.
If a child is committed to the state, it is the agency that provides that parental consent. But if a parent is unavailable, cannot be located, or refuses to consent to treatment, the agency can seek a court order. It's unclear how often Eckerd is taking this step.
That is another data question that I just don't have the data.
In June, 2 months after the DCF memo, a letter from the federal government went out to child welfare leaders saying, as a disproportionate percentage of children and youth in foster care are children of color from underserved communities, it is especially important to be proactive and take all the measures possible to prioritize access to vaccinations.
And when I hear that there's a community that's relying on kids to come forward and say, by the way, I would like a vaccine, if nobody is telling them that they have the right to ask for the vaccine, then that's meaningless. So it's really a patchwork.
What does that mean for the health and well-being of Florida children?
I think it jeopardizes children, and I think it jeopardizes the adults who live with those children.
Well, a lot of kids will say, I don't understand, my mom is a drug addict and she puts all the bad drugs in her, so why would she deny me a COVID vaccination that could save my life or save somebody else's life? It's sad.
Most states require parental consent for vaccinations, but we found not all. For example, in Alabama, you just have to be at least 14. In South Carolina, at least 16 years old. Then at least 2 cities, San Francisco and Philadelphia, are now allowing minors 12 and older to self-consent for the COVID vaccination.
Hopefully somebody steps in and lets these children get the COVID shot if they really are begging for it. And that's what they're doing. They're begging for it.
On August 23rd, the FDA approved the first COVID-19 vaccine for people 16 and older. This is expected to remove some of the barriers to getting kids vaccinated within that age group in child welfare. We've reached out to DCF multiple times asking for an interview about what it's doing to protect kids through the vaccine and any preparation for when eligibility expands to include kids 12 and younger. We're still waiting. I'm I-Team investigator Kylie McGivern, taking action for you.